Today let us discuss on the topic scalp. Now what is scalp? Scalp is a soft tissue covering the skull vault or cranial vault. Now let us see the extent. If you look at this picture, we can see that it extends anteriorly up to the superciliary arch, that is up to the eyebrows, and posteriorly it extends up to the superior nuchal line, and laterally it extends up to the superior temporal line. Now moving on to the layers, it is often remembered by the mnemonic SCALP. That is, S stands for skin, C for connective tissue, which is the superficial fascia, A for aponeurosis, which is the deep fascia, and L, that is the loose areolar tissue, and P for pericranium. Now this picture shows the layers of scalp. Here the first layer, which is marked in orange, is the skin. The skin is a thick layer and it has many hair follicles and sebaceous gland, and hence it is the commonest site for sebaceous cyst. Now the layer deeper to it is the connective tissue, which is the superficial fascia. The blood vessels and nerves of the scalp lie in this layer, and the blood vessels are adherent to the fibrous tissue, and any tear in the blood vessels cause profuse bleeding because they are unable to retract. The next layer, which is marked in green, is the aponeurotic layer. Now this picture shows the aponeurosis layer. It is formed by the occipitofrontalis muscle, and the occipitofrontalis muscle has four bellies, that is the two occipital bellies and the two frontal bellies. And the greater part, that is this green part, is formed by the aponeurosis. The aponeurosis is under tension in anteroposterior direction by the tone of occipitofrontalis muscle. So the wounds of the aponeurosis don't gape unless the aponeurosis is cut transversely. The next layer, that is the layer marked here, is the loose areolar tissue. The loose areolar tissue is traversed by the emissary vein. This is the emissary vein. It is traversed by the emissary vein and it connects the second layer of the scalp, that is the connective tissue, to the intracranial dural venous sinuses. Here is the dural venous sinuses. It connects the second layer to the intracranial dural venous sinuses, and this layer is called the dangerous area of the scalp because it can cause the spread of infection via the emissary vein into the dural venous sinuses, causing meningitis, which leads to thrombus. The next layer, which is marked here, is the pericranium. This forms the bony part of the skull and it is formed by the periosteum of the vault of the skull.